Hi all, this is Dr. Rakesh, dental surgeon from Kauvery Hospital, Zalwarpet. I am here to discuss on the topic oral health is the gateway to good general health. Here we have three sections to discuss about. One is pediatric dentistry, the other one is adult dentistry, the third one is geriatric dentistry. To talk about pediatric dentistry, the first tooth which erupts in the oral cavity is about 6 months of the kid's life. So from the 6th month of anybody's life, our oral hygiene should be perfect for us to have a very good general health. The kid's oral cavity has to be clean even before the tooth could erupt. The first tooth erupts about 6 months and it goes on till 6 years to 10 years for it to get the permanent teeth. The second thing we have to concentrate on is during breastfeeding and bottle feeding, the oral hygiene is bit compromised as far as the pediatric kid is concerned. So what we have to do is we have to make sure after every meal or after every feed we have to clean the entire oral cavity either using a kid's brush or a finger brush or even a gauze. We can use fluoridated toothpaste in the case of kids who are 3 to 6 years and above. In the case of kids who are below 3 years, we can just use a mouth rinse, dip the gauze or the finger brush inside the mouth rinse and clean the oral cavity. If we do not maintain the oral hygiene of the kid, it could end up in something called nursing bottle caries. The nursing bottle caries could be extremely painful for a growing kid. It could spread through the entire primary dentition. So we have to make sure prevention is better than cure. So I would advise all the parents to make sure they clean the oral cavity of the kid after every meal. Morning and night brushing can start up once the kid joins the school. Before that, it is the bounden duty of the parent to make sure the oral cavity is completely clean. The other problems are parafunctional habits which the kid can develop during the oral stage. Thumb sucking, lip biting, nail biting and tooth grinding, all these habits develop during the growing stage of the kid. It is better to wean off these habits by parents distracting them through other games or other activities. Through all these parafunctional habits, what happens is the jaw size or the tooth alignment could change and it could change the entire face structure of the growing kid. So it is ideal for us to give something like a functional appliance which could modify the growth. As far as the nursing bottle caries or the rampant caries in the kids are concerned, we can either treat it using a local anesthesia in the dental OP or we can make use of the general anesthesia ward wherein we are given conscious sedation and made the kid to sleep for half an hour or 1 hour and we complete the entire procedure. Few kids are cooperative for dental treatments and few kids are not. So local anesthesia will be helpful for people who are cooperative. General anesthesia will be helpful for kids who are not cooperative and who are compromised in their general health. Adult dentistry is about permanent dentition. At about 12 years of age, the kid would have had the entire permanent dentition erupted. These teeth are going to help the kid for the entire of his life. So it is our bounden duty to maintain the oral hygiene, not to have any dental infections or gum infections. There could be some malalignment during this part of his life. So probably we should help him with an orthodontist where the alignment of the tooth is corrected and his face and appearance are modified according to his growth. This generation of people has got a problem with wisdom teeth because the jaw size is not big enough to accommodate the entire third molar. So there could be some partial eruption or the entire third molar could be impacted within the jaw. This could lead to something called pericoronitis, wherein the individual could develop lot of infection, pain or swelling or restricted mouth opening. During this phase, we are bound to take a full mouth X-ray which is called an orthopantomogram and probably we may have to extract the wisdom tooth if it is needed. If the wisdom tooth is not hurting, then we just ignore it and use it as part of our oral cavity. The hygiene levels for a teenager should be really good because the tooth is at its best and we can use the tooth for munching, mastication and for having a very good smile. There are many cosmetic dental treatments which are available for an adult. Those cosmetic dental treatments could be tooth whitening, tooth alignment, it could be tooth jewelry. All these cosmetic treatments could help in enhancing one's smile. The third section we are going to go about is the geriatric dentistry, which is the most important because as geriatric patients we face a lot of health issues. Most of the times in Indian scenario, dental health is ignored. Oral infections are connected to all the systemic infections. So, to prevent us from having any other health issues, it is better to have good oral hygiene. Vice versa, there are other drugs which are given to systemic infections and systemic illness, which could infect or which could give inflammation to oral tissues. Oral soft tissues could turn dry because of dryness of mouth and less of saliva, which is called xerostomia. The second thing could be gingival hypertrophy. Many drugs could cause gingival hypertrophy as well. Many diagnoses are made based on oral tissues. So those are inferences which we get to diagnose systemic illnesses. It is better if we don't extract natural teeth. Natural tooth has always to be preserved. If anybody has got natural teeth to the entirety of his life, then that is the biggest asset he can have. So it is our duty to prevent the natural tooth from dental infections, gum infections by visiting a dentist every 6 months and also taking care of our dental health ourselves. Morning and night brushing is a must. If we happen to go for any dental extractions, it is our duty to replace even if it is a single tooth. A single tooth extraction also could cause lot of handicap in our entire masticatory system. As we all know, our digestive tract starts with our oral cavity. Lot of digestion happens in our oral cavity. There are many methods of replacement like dental implants, bridges, removable partial dentures. So we can make use of any one of these methods according to our feasibility, economic feasibility, or according to our bone levels, according to our facilities available. So we can go ahead replacing that particular natural tooth. Most of the oral infections are asymptomatic at the beginning. It turns symptomatic only at the last stage. So most of us try ignoring the oral infections. It is better if we keep monitoring the oral infection. Probably an individual may not be able to do it by himself. He has to go to a nearby dental clinic or a dentist to make sure his oral cavity is clean and is devoid of any tooth or gum related infections. Gum related infections are silent killers because they do not show up with lot of symptoms. They are totally devoid of symptoms and it makes our tooth mobile, and by the time we could even realize we have a disease, we lose our tooth and we have to shell out our money on artificial teeth. It is better we try visiting your dentist every 6 months. This will help you in the long run. Thank you.